Female urinary catheterization.
Hi, good morning. My name is Caster Kaimer from BSN 12F, and today I will be performing female urinary catheterization. So catheterization is the insertion of a catheter in a patient's bladder. So first is we are going to check the doctor's order for catheterization to verify if patient is eligible for catheterization. Okay, and the next is we are going to wash our hands before preparing the set. This is to deter the spread of microorganisms. So prior to the procedure, I had already done my hand hygiene or performing hand washing. So next is we are going to identify patient and explain the procedure to let the patient understand the procedure and gain patient's cooperation. Hi, good morning ma'am. My name is Caster Kaima, your student nurse for today. May I see your wristband please? Can you state your complete name? Alright. So now ma'am, what I am going to do is I am going to insert a catheter in your urinary or urethral meatus for you to excrete the urine in your bladder. Would that be alright? Okay, thank you. So now next is we are going to provide privacy by screening or closing the room and position the patient in a dorsorecumbent with knees flexed. So this will lessen the anxiety and good visualization of the meatus that will be essential to introduce the catheter. So now ma'am, may I ask if you can flex your knees, alright, and also spread your legs for me to have a better visualization of your genital. Okay, thank you. So now is we are going to drape the patient, exposing only the area to be used. So minimal exposure will lessen the embarrassment and helps to provide warmth for the patient. So now ma'am, I am going to drape the blanket and I will only be exposing the area that I am going to I will be needing to see. Okay, so now is we are going to apply direct light for visualization of the genital area. So this may interfere with the easy introduction of the catheter. Okay, now we have a better visualization of our genital area. So next is we are going to open the tray and arrange the equipment for convenience and accordingly to avoid contamination of the sterile items. So placing the equipment in order will increase speed of performance. So we are going to open our sterile. So using our sterile forceps, we are going to cleanse the area of the genital using cotton ball with betadine. This is thorough cleaning of the meatus and the area surrounding it reduces possible introduction of the microorganisms in the bladder. So this is our cotton balls. So we are going to use our working gloves. So imagine that our cotton balls is already soaked in a betadine. We are going to cleanse the genital area starting from the symphysis pubis to the anus. And then discard it. And the next is mons pubis to the external labium. Next is mons pubis to the external labium and then to the internal labium. Then discard. And then to the other side. So afterwards is we are going to open the set and observing sterile technique to maintain sterility. So I am going to open the set and then we are going to put on the sterile gloves to ensure infection control. So using our pickup forceps, we are going to get our sterile gloves. And the next is we are going to put our eye sheet to minimize the exposure of the area. And then now, using our lubricant, we are going to lubricate the catheter about 1 1/2 inches, being careful not to plug the eye of the catheter. So lubricants reduces the friction. So this is our lubricant, and we are going to get our catheter. And then lubricate it. And then now we are going to pick up the catheter at least 3 inches from the tip of our thumb. Place the thumb and 1 finger of the left or right hand between the labia minora. So separate and pull up gently when you touch the labia minora. Okay. So separating the area surrounding the meatus provides visibility of the meatus. So next is to insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. So now we are going to insert. Now ma'am, I am going to insert the catheter in your urinary urethra meatus. Okay. Alright, so next is we are going to if a specimen is to be collected, we are going to pinch the catheter with the thumb and finger while placing the specimen container in position. So we are going to get our specimen container and then place the catheter in it so that we can be able to get a specimen. So next is we are going to rest the hand in the pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. So this is what are we going to do. Withdrawing the catheter and pushing it back in the urethra increases the possibility of contamination to the urethra. Okay, so now we can put this back and then relax our thumb and fingers so that we can prevent pushing and pulling the catheter outside the urethra meatus. So now next is we are going to connect the catheter to the urine bag. Now we are going to get so this is our urine bag. We are going to connect this to the catheter. So next is we are going to inflate the balloon 10 to 15 cc of sterile water using our 15 to 20 cc syringe. So this is our 15 to 20 cc syringe, and we are going to inflate our catheter with sterile water. Now I'm going to inflate the catheter. Okay, so next is we are going to discard this one. And the next is we are going to secure the indwelling catheter by taping it to the patient's thigh. So we should allow some slack of the tubing to accommodate the patient's movement. In taping is we must not tape under the legs because it may cause a pressure sore to the patient. So imagine that this area is the legs of our patient. We are going to tape the tube in here. So now we are just going to get rid of this eye sheet. And then we have to place the patient comfortably. So now, ma'am, I am going to cover you up with this blanket. So we are going to ensure that the bag is under the bed of the patient or at the side of the patient. Next is we are going to do aftercare and record the time of procedure done, amount and color of initial output for because for documentation purpose that procedure was done and for means of communication. So we are going to discard. And then we have to roll this up and then perform hand hygiene. So ma'am, I am going to go back and check for your urine output when I get back here, okay? So hi ma'am, now I'm going to check for your urine output. And the normal urine output or the volume in 24 hours or per day should be 800 to 2000 milliliters. And the normal color should be pale yellow to deep amber. Okay, so it's good. Now that we are done, we are going to document everything, and that's all. Thank you.